Hi everyone, my name is Ilaria Cinelli. I am a senior analog astronaut and I'm a biomedical engineer. I work in implementation and research, and one of the work that I took part was the VapoJet. The VapoJet is designed by Dr. Ishikita, and it's a 3D printed ventilator for delivering oxygen and anesthesia. And I tested VapoJet during an analog mission done in the Mojave Desert in California, and that was organized by the Mars Academy. And Susan Jewell is the CEO and founder of the Mars Academy. Okay, so the VapoJet at the site, it was designed for medical assistance in the desert, thinking of a human life on Mars. So when you have a medical emergency on Mars, the worst case scenario is that the medical doctor itself is incapacitated to provide any assistance. Therefore, when someone who doesn't have medical training has to provide the assistance himself, 3D printing any medical tools is a pretty handy way for producing any tools that you might need on a trip to Mars, and that works well. For what concerns surgery, we need different type of 3D printing items and parts for replicating whatever it is now in the theater, in the rooms of hospital for surgery. And so 3D printing works well. We tested on a dummy. And the reason is because you cannot do this kind of tests up to now. So for looking at the global organization, 3D print is really, really interesting, but the FDA is not actually it's not actually approving any of those medical devices, as probably it's going to be after the coronavirus. We printed out the VapoJet in the desert, in isolation. It takes really short time, and then you can just use it for delivering oxygen or anesthesia. When you look about the epidemic context, those hands, when they are very severe, like now, and there is a fast spreading epidemics, they have similarity with human spaceflight context, specifically with human mission to Mars. And we need to take advances from this context and then translate it back to the epidemic, to the healthcare on Earth. 3D printing, it helps dealing with medical challenges. And the reason is because now it is tested for a human mission to Mars. It's not actually tested for a surgical for saving life on Earth. It hasn't been tested yet, but it can be used when the condition of the epidemic is so severe that we really get no other chance. Therefore, it is not approved, but if you really run out of any supplies, you really got nothing to use, then try to give it a go, because potentially you could save life. First, collaboration. We need international collaboration to fight coronavirus. And it's not an Italian problem, it's not a European problem, it's a worldwide problem. So we need to get it down. We need to have an open database, open research, and anything that really people can work on. And we need to be connected. And it is hard because in the globalization, we need to aim at one unique goal, which is now surviving without the coronavirus. Then look at innovation, emerging technology that are implemented in a context like humanitarian crisis or analog missions. And this is why I'm pushing in this field. And then the third, look at space. Space is a resource that leads innovation and actually can help dealing with many different types of medical challenges. The policy making is a little bit hard, like in Europe. This is from what concerns my understanding. Europe, it shows itself as a little bit weak in the policy and in dealing with crisis. We need to have policies and international guidelines, right, that helps countries dealing with problems like epidemics. And to my understanding, the work that has been done right now or is not enough or is not effective. because the crisis is affecting too many people in so many different ways that we actually have difficulties in controlling it. We're gonna make it. We're gonna make it if we're gonna work together. If really we wanna get out from this, then we are gonna make it. We need to collaborate, and we need to put aside our own business, our own problem. We need to focus on to resolve. I think researchers and any type of researcher can actually help in bringing any contribution to help dealing with the coronavirus. But we really need to believe that we are gonna get out of this situation all together.